Good morning, everyone. Welcome to the E-Institute webinar today. My name is Antonio Paniagua, and I'm going to host this webinar on Global Health and Human Rights Database, a free online legal tool for bringing people together and improving lives. Today we have with us Oscar Cabrera and Ana Ayala. Oscar is the Executive Director of the O'Neill Institute for National and Global Health Law and visiting Professor of Law at Georgetown University Law Center. Previously, Oscar has served as the Deputy Director, Senior Fellow, and a Law Fellow. He is a foreign-trained attorney who earned his law degree in his home country of Venezuela and his Master of Laws with concentration in health, law, and policy at the University of Toronto. Before starting his master's degree program, Oscar worked as an associate at the Venezuelan law firm Damper Reina Bermudez. And Ana Ayala is an institute associate at O'Neill Institute for National and Global Health Law at Georgetown University since 2010. Ana has worked in projects on a number of areas of global health law, including health and human rights, global tobacco control litigation, sexual and reproductive health, patient rights, and the Global Organization International Health Regulations in 2005. For the past 4 years, Ana has been in charge of managing the database project and leading the Institute's work in developing international partnerships for the project. So welcome both of you and welcome everybody to the webinar. We are going to start with Oscar, who is going to make an introduction to the database, and after that, Anna is going to continue with the technical content. So, welcome, and thank you for
Thank you very much to the World Bank Institute and the e-learning Institute for allowing us to present on our database. I should start by saying that Larry Gustin was supposed to be here to present the English version. Unfortunately, due to difficulties with his schedule, he couldn't make it today. So what I will do is I'll try to give a very brief introduction to the goals, the objective, the history of the database, and then I'll pass it on to Anna so Anna can elaborate in more detail about the project and the more technical dimension of it. So the database started as a partnership. Right now it's a partnership between the O'Neill Institute and the Lawyers Collective. The main structure of the database, what we pursue with the database, is try to compile cases, international instruments, and the national constitutions that deal with health and human rights, decisions that deal with health and human rights, international instruments, human rights instruments that have a health and human rights component, and also health-related provisions of domestic constitutions. So there are three databases within our broader database. So what was the objective? What was the goal of this project? When we started working on it, we noticed that there was not such a database. This is a project that originally the O'Neill Institute started working with the World Health Organization in 2007. Then in 2008, we partnered with the Lawyers Collective because they were also doing a similar project. So we decided to combine our efforts and work together on one project. So right now, it's a partnership between the Lawyers Collective and the O'Neill Institute. So there was nothing like that. There's no database in the world that could encompass health-related decisions that had a connection with constitutional rights or with human rights law. So what we decided was to start this process of categorizing the decisions, including them in a very easy, accessible format on the website, and make it free and available to anyone that wants to use it. So who's the audience, the intended audience of this this database? Is lawyers that are practicing, they want to have access to comparative decisions, but in general, anyone that is interested in learning more, knowing more about health and human rights, civil society organizations, government officials that want to know what other countries are doing and how cases have been decided in other countries. So I think that's kind of a very basic introduction of where we are right now. Anna will walk you more on details on the number of cases, the decisions. In terms of next steps, what we're trying to do is grow the database. Of course, we need to include decisions from more regions, more countries. We're always looking for partners, people that are interested in contributing to the project or being engaged in the database. So if any of you is interested in partnering or being engaged in this project, please feel free to let us know. But also, I think at this point, the database is just a collection of, I'm going to misuse this term, but it's a collection of data. We have the decisions, we have the instruments, but it's there. There's no analytical dimension to it. So the idea for a project moving forward will be to start doing that analysis, start developing some analytical tools, start identifying best practices or trends regionally, by country, by health topic, or by specific right. So I think it's a very exciting project that we're all very happy to be working on. And it's not just, I mentioned the Institute and the Lawyers Collective, but there are a lot of other organizations and people we should acknowledge for having participated in the database. And I think Anna will address that in detail. But I see amongst the participants that Benjamin Meyer from the University of North Carolina is participating. And he's been an active contributor, and he has helped us design and conceptualize the database from the beginning. So I just want to mention Ben, who's participating in the call, and other partners. And Anna will just probably work you more in detail through those partners. So I'll pass it on to Anna so she can.
Hello, everybody. It is a pleasure to be here and to once again talk about the database in a more public forum. This is a very important project for the Institute, and it's been a real pleasure to be working on it, and especially with the Lawyers Collective, who have really helped grow the database much more. And I want to just highlight some of the features in the database. Once we go into the actual website of the database, you won't be seeing the chat option or the I guess the video. You'll see the actual website. The database is a collaboration of more than 100 partners, and as Oscar mentioned, the network is growing. It is composed of NGOs. The collaboration has been with NGOs, academics, individual private researchers, law firms, and law students. And now let's turn to the actual website of the database, which is globalhealthrights.org. And there you go. Okay. So one of the things that I want to highlight particularly is that the information that's contained in the database is from over 80 countries and in 25 languages. We identify relevant cases, instruments, and national constitutions using a particular type of research methodology, and you can review this yourselves by going to About the Database, and I'll show you right now what it looks like. And these are the research methods that we use to identify relevant judgments, instruments, and constitutions. So we select the relevant judgments when the specific case is adjudicated by an international, regional, or domestic court, or even a quasi-judicial body such as the UN Human Rights Committee or the Inter-American Commission on Human Rights. Whenever the case implicates a specific topic, health topic, and when it argues a right of individuals or groups or an obligation of duty bearers, primarily states, referenced in the relevant international or national law. Now with the instruments, we consider those instruments that are binding under international law or integral component of global health policy, and those that have provisions that address health-related rights of individuals or groups, or establish an obligation of duty bearers. The constitutions that are contained in the database have been included based on whether they address a right or an obligation considered to be explicitly linked with or interpreted in relation to health or an underlying determinant of health, and when it explicitly states the right as a right of individuals or groups or an obligation of duty bearers. Now let's go into the actual judgment section. The judgment section is the principal database we consider. It is much more elaborate. It is the section that categorizes cases based on health topics and human rights, and this is one of the things that makes our database particularly unique. And we have right now over 1,000 cases with 200 original translations of case law previously unavailable in English. It covers the full breadth of health-related rights issues, everything from sexual and reproductive health to health systems and financing to occupational and environmental health. And you can see the health topics. This is easily accessible by going to health topics here right on the map. These are all the ones that are currently included in the database. And if you hover the mouse over the human rights, you see the list of all the different human rights that are currently contained in the database that we're currently using to categorize cases. And now the question is, how can the user go about finding cases? There are 4 ways that the user can do this. One is this colorful map that you see in front of you. And by hovering the mouse on specific countries, you see that the map will indicate exactly how many cases we currently have on the database for that particular country. So for example, let's go to Argentina, which has 29 judgments. And that is the results page. You can also use the search box, which is found in each of the pages from the results page or all the other pages, such as the summary page that we will review a little bit later. But it's also available in the home page. And you can use keywords in order to find your case, specific cases that touch on health topics or human rights. So, for example, we can do tuberculosis. And that will give you all the different case summaries or even PDFs of documents that contain that particular term. Another way to find cases is by using the advanced search option that is also available in every page within the database website. And you can find specific cases using a number of criteria. So for example, let's do a search for, if I'm interested in cases from Colombia, for example. That involve healthcare and health services. And also freedom from discrimination. Between the years of 2000 and 2014. So as you can see, there are 9 judgments that fit that criteria. Now let's go to talk a little bit about the menus that you find here in the homepage. This is the last way that a user could actually find cases. We have judgments by health topics, region, international bodies, human rights, by country, or regional body. So for example, let's go to all those cases contained in the database that come from the Inter-American Commission of Human Rights. And as you can see, we have 52 judgments currently from the Inter-American Commission. Sorry. Oops. Okay. So what I'm going to do is go to a specific case to show you what the results page looks like. What are the different ways that you can sort judgments, for example, that within the results page. You can sort them by year, court, or title. And if you go to you will see here that each of the cases, you can see all the basic details of the particular case. So country, year, courts, the citation for that case, the health topics and human rights involved, and a little excerpt from the fact summary, as well as a link to downloading the judgment in its available languages. So let's go to this particular case from the Inter-American Court to see exactly what a summary page looks like. So as you can see, you have the same basic details listed here, but in addition, you have different tabs that make up the summary of the case itself. So you have judgment details. Click on facts. You have a short, brief discussion or summary of the case itself, as well as a summary of the decision of the Inter-American Court, as well as its reasoning for each of the holdings, excerpts. And something to highlight is that these excerpts have been selected particularly for what they add to the whole discourse of health and human rights, and also additional documents. For this case, we don't have any right now, but this is intended to include cases, documents that have been submitted, for example, by the parties in the case, etc. Another feature that I want to highlight, if we go here to judgment details, is that we have tags that reflect the different health-related terms that are involved in the case. Currently, we have over 400 of them, and this is to help the user find the cases that involve those particular health issues. And something else that I would like to point out is that not only can you download the judgment in its available languages from here, but also that you can view the whole summary and print by clicking on this link. Or you should be able to do that. Or downloading the summary as PDF as well. And basically, the other link should give you the same exact information. Okay, and something else that I'll point out is that here you have on the right-hand side related judgments. And these are judgments that share similar characteristics with the case that you have in front of you, particularly the way that they have been categorized by health topic and human rights. Finally, let's go to the other sections of the database. So, as we mentioned, we also have instruments that reflect the intersection between health and human rights. And these are simpler than the judgment section of the database. And currently, we have different ways of filtering the results. If you go from here, you will see that you can filter by region. So let's do Africa, for example, by legal status. So if we're looking for example, non-binding instruments, it should give you all those instruments that fit that criteria. And you can go to the actual instrument itself, and they are not summarized because it's not as useful, but rather we give you excerpts that are relevant to health and human rights. You can download the full text of the decision by going to this link. It's all in its available languages within the database. And the Constitution section has a similar system. Right now we have 68 constitutions, more are coming. Let's do, for example, America's. and freedom from torture. And let's go to Mexico. And here you see that it also lists all the human rights that are enshrined in the Constitution, but also all the excerpts related. So if we're looking for torture, you will see that Article 22 has been included. Something else that I will point out that it's available both in the National Constitution section, but also in the International and Regional Instruments section, is this option to PDF and print the summary itself. And finally, I'll just briefly highlight some of the other features that we offer in the database. If for some reason you are unable to find a judgment that you know about, for example, that's not contained in the database, there is a way that you can share the judgment with us. And you can go by clicking, you can do it by clicking on this Share a Judgment tab. You just enter your name, your email, in case we have more questions about it, and you can tell us a little bit about the judgment and why you think it's relevant to the database. And if you happen to have the text of the file, which we welcome very much, you can attach it to it and submit it to us. Another way that you can do it is by contacting us using this Contact Us tab. It will give you the email address to which you can submit the judgment, instrument, or national constitution. Or if you have any comments, any input on how we can improve the database, or if you're interested in collaborating with us as a partner, as Oscar mentioned, we are hoping to expand our network of partners. And again, what I will just highlight is that to us, since the public launch of the database, we see this as the opportunity for the whole community to contribute to the population of the database. And it is what's going to make the database much more useful to users, particularly those that are unable to access the cases, instruments, and constitutions otherwise. And one last thing that I'll point out is that we have a resources tab here that lists some of the places where we recommend our users to go to in case they're more interested in specific topics. For example, WaterLex has a database that touches particularly on right to water and sanitation. They contain laws involving that issue. Just to end this presentation, we are hoping that we can make the website available in other languages. As you can see, we are starting to develop the Spanish version of the website. It is not complete. It will require much work, but we have started that, and hopefully in other languages in the future. We're also looking to develop a mechanism to better track the type of users that are coming to use the database. We are hoping to also develop the ability to cross-reference among judgments, instruments, and constitutions so that the user can go back and forth between the judgments that mention specific instruments or constitutions. The user would be able to go to the summaries of those constitutions or instruments. And also developing the advanced search capability for instruments and constitutions. And I thank you very much, and we will now turn to questions.
So let's continue with some interactive questions. And the first question is, what type of documents does the database contain? As an option A, you can start voting right now, you want. Option A is A, case law, B, international and regional legal instruments, C, national constitutions, D, all of the above. So please vote, and Anna, can you?
Yes, and I can see that everyone was listening. and that everyone understood that all of these instruments and case laws are included in the database.
Perfect. Let's continue with the next question. It's okay, number 2. How many cases do you think the database currently contains? Please start voting. A, 700, B, 800, C, 900, and D, over 1,000. Let's see, the people are still voting. Let's give 2 more seconds. Okay. Anna.
Okay, well, a majority of you got it right. We have actually 1,077 cases currently in the database. So yes, D would be the right answer.
Very impressive. Question number 3. How many countries do you think the database currently covers? A, 50, B, 60, C, 70, and D, 80. So let's give 2 more seconds. Okay. What is the result?
Yes, actually it's D, 80, and I would actually add that it's more than 80.
Perfect. Let's do the last question. How does one submit a document not contained in the database? A, form provide on the website. B, sending by email. C, all of the above. So.
Yeah, so most of you got it right. You can submit a judgment, instrument, or constitution using the form that's provided in the website, also by emailing us at contact@globalhealthrights.org.
Perfect. Okay, very good. So let's continue now with interactive with the questions from the audience. Let's start with Keith Martin. He's asking, is there a mechanism for people to discuss issues, advocate, mobilize people on this site? Thanks, Keith. So who would like to answer?
Keith, first of all, thank you very much for your question. Keith Martin is with the Consortium of University Global Health. So I think, your question is very relevant. This is part of what we think we would like to do moving forward with the database as a project to create that community. There's the whole idea of revamping a blog that we, at some point, we're thinking around the database. But I said it at the beginning of the presentation, this is a first step, and we think there's much more space for us to kind of create a sense of health and human rights community around the database. So finding mechanisms for people to discuss, advocate, mobilize, this is something that we want this to, as a tool to serve that goal as well. Anna, I'm not sure if you want to add anything to that.
No, I think that's
The second is, I don't know if it's a question or it's just a comment from Keith Martin again saying, can one share current human rights abuses like rape in the car, killing of health workers in Syria, murder of small-scale farmers in Central America, and mobilize people to share this info and advocate for action to stop these atrocities? Do you have any comment to that? Or?
At this point, the database is not structured to serve that goal, but that's something we're looking into. We said this is a phased approach. We're finishing phase 1, which we categorize, including the information. Moving forward, we would like for this to serve as a hub, so we can have those type of discussions or share that type of information. So, yeah, it's something that we'd like to do down the line.
Okay. Next question is from George Harin Gizen. I hope I pronounced it correctly. Can one send in cases of foreign language for you to translate and upload into the database?
Yes, and I'll answer that. Yes, of course. We actually have some partners, for example, law firms that have even offered the opportunity for us to have cases translated. We also count with the collaboration with particular individuals that are also translating cases. So definitely.
Thank you. Benjamin Meyer is asking, related to Keith's question, how can advocates and scholars use the database to compare judgments across countries and develop best practices?
Okay. Yes, the idea is that advocates and scholars can use can use a database in order to develop their arguments. That, for example, I will say that both that Africa and the Americas look to one another a lot in terms of developing human rights standards and that. And we expect that this type of sharing of experiences, of litigation strategies, will be able to, will become more prominent through the use of the database.
And if I just may add to that, Ben, thanks so much for your question. I think Ada mentioned, by using the health topic function, you could see how different countries have decided cases around different health topics, or by using the rights search option, you can also get cases around specific rights. So in that sense, that would be a good kind of, as a search engine, a good tool for scholars and people that want to do this type of research to use a database. Also, in terms of best practices, and I've said this probably way too many times, but we see this as an incremental process. We're also thinking right now in brainstorming about adding another dimension to the database that will look at UN treaty monitoring bodies and concluding recommendation, country reporting, and specific recommendations that treaty monitoring bodies have made to countries around health. And that's another way in which we can build this best practices approach by looking at comparative, looking at that broader UN framework.
Next question is from Paola Cecia. It's a very good question. She is asking, does the database permit the established content among database users?
That is a very good question. And what I'll say is that from the inception, the idea was to create a community of health and human rights advocates. And so this is something that is very much an interest of us to create that forum where people can exchange ideas and experiences. So that is something actually that we hope to develop in the coming phase.
Okay. We are going to go to the next question from Rhiannon Di Clemente. The question is, are cases regarding abortion rights included in the section of sexual and reproductive rights?
And yes, they are included in this. If you go to sexual reproductive health, you should be able to find a number of cases that regard abortion rights.
Yes. And just to connect with this in the previous question, the way we envision this project is a collaborative project. Right now, there are two institutions that are leading the project, but we're always trying to find more partners and include more institutional partners, but also individuals. I mean, we want to do this as a service to provide the cases for free, available online, but also to use it to foster that sense of community. So all of the questions that we have had from Keith and Paola about the sense of how do we bring activists or people working on these topics together, it's a goal that we're trying to achieve as well, and we'll definitely keep trying to strive for that as we move forward.
Okay. Let's continue. Keith Martin is asking, relating to Ben's question, will you create a space to post good best practices and those who can train others in strengthening judicial capabilities?
Sure. I said at the beginning, we're moving to stage 2 right now, in which that's for us the analytical stage. Right now, the information is presented in a descriptive manner. We're not doing any assessment. We're not doing any analysis on it. We're just putting the cases, categorizing them, and using the specific methodology that Anna explained. But the idea is that now we're going to start doing that analysis, and we're going to start making those assessments on best practices and sharing that information in the database. And definitely that can be used to strengthen judicial capabilities. And we have used or tested the database when we have conducted training in the judiciary in different countries on different health-related topics. It is a very useful tool for judges that want to know what other countries are doing and want to really understand how health rights has been adjudicated in other countries. So they see this as a tool. So we have pilot tested, we have used this in some of the training we have done at the O'Neill Institute in the past. But Keith, I agree with you. This is something that we need to work more actively and try to make it happen and put it as a resource out there for people to use.
Okay. I have a question for you too. Who is in charge and who is, I mean, how often do you update the database and who is in charge of updating the database?
Actually, we have, so on the Institute side, I'm the one who's in charge of managing that, that aspect. We have research assistants and interns that work with us to identify cases. And also the Lawyers Collective on their end, they have also project managers who are in charge of also identifying and processing the cases and instruments in national constitutions as well.
Excellent.
Mm-hmm.
We have another comment from Keith Martin. He says, like, we at CUGH will be delighted to support and strengthen the excellent human rights instrument you have created. Well done. Okay.
Thank you, Keith.
Thank you very much, Keith. Yeah, we'll definitely look forward to exploring ways in which the great work that you have done around health and human rights, that we can complement it and how we can strengthen and connect the different projects. So thanks so much for that.
And so just taking advantage of the fact that no one's asking questions at this point right now, I'll just mention some of the type of partners that we have currently working with us on summarizing cases and processing them. We are very thankful to the Van Center, the Cyrus Van Center, a clearinghouse for pro bono, who has put us in touch with law firms who have offered summer associate and first-year associate time in order to help summarize the cases. At a time, we have about 15 to 20 people who are dedicated to doing this, and we are very, very thankful to them because we're able to process cases much faster than otherwise. And if you are interested in helping out with the database, you know, there is so much flexibility in terms of whether you're willing to do just research and identifying cases, instruments, or constitutions, or if you want to just summarize, or if you want to do both. Do you have anything to
No, we have more questions.
Okay.
We have some positive feedbacks about the database, like some, you know, like thanks for the database. This is a great initiative. Thank you for doing it and sharing it. And we have a question from Josita Pavazutipaisit. Will the best practice we discuss about cover part of policy in developing countries that needs and appropriate for marginalized people like disabled children and also different cultures? Do you have?
That's part of what we're designing right now. This is a very good question. We're trying to understand how we can advance health as a social good by using the rights-based discourse. So we agree with that assessment. We definitely need to look beyond I mean, starting from a legal perspective, look at the policy dimension, and marginalized groups, vulnerable populations are usually protected by specific human rights instruments. So they're definitely at the center of what we will do when we move to the analytical side of the work. So definitely we would like to I mean, that's one of the goals, to incorporate that into an analysis. I think there's one other question from George.
Did you so far reject any case concerning human rights and health? If so, on what criteria? Thanks, George, for your question.
Yes, George, thank you for the question. It's actually a very good question because there are cases that we have rejected because even though the issues raised concern health and human rights, because they are only decided on admissibility, we do reject those cases. But whenever the case is a merit decision, then that's when we include it, because that's when when the court actually analyzes the health issue and develops, the content of the particular rights involved, and that's what adds to the database.
George, just to complement what Anna just said, we try to err on the side of being over-inclusive. So if there's a case that it's in the gray area, we'll try to include it just to make sure that we are comprehensive in our inclusion of cases. But basically what we do is just follow the methodology. If you look at the methods section, you'll see what's the criteria, what's the threshold, and based on that, those are the cases that make it into the database. I mean, we need to curate the information so it's useful for users, but we try to cast a very wide net, so we include as many cases as we can.
Well, it looks like we have another coming question, or let's wait. Do you have anything to comment more than?
I just had one small comment connected to one of the previous questions about reproductive rights. The goal of this project is to bring together different communities within the health and human rights space. So we have collaborated, for example, with Women's Link Worldwide, with the Center for Reproductive Rights and UNFPA to try to gather cases around sexual and reproductive rights. There are other organizations that are bringing that information. So you can see it's multiple health-related organizations that can contribute to that database are very welcome to be part of this process. So it's all about being inclusive and working with different partners.
I have a question. Do you have cases of mental health in this database? Okay.
Yes, mental health is one of the health topics that is included in the database. Okay. You'll definitely find that. And I'll just mention something that was brought up in one of the panels in the official launch of the database last year in October, that it's something that we didn't necessarily consider, but one of the panelists just brought up the fact that the database can actually track what is going on in the health and human rights field. What are the actual trends? Where is it that more attention needs to be paid, in particular issues? So for example, I'll just give you, palliative care is one of the health topics that is not included in our list of health topics, and we haven't come across many cases, but it is an area where there is much movement right now. So yes.
We have a question from Leonardo Cubillos for Anna. It's like, do you recall the type of mental health cases you have in the database? I know it's a bit of stretch, but still.
I mean, certainly. There's, for example, a very important case from the Inter-American Court, the Jimenez Lopez v. Brazil case, where it set pretty important standards in terms of the rights that would be involved in order to protect mental health patients.
Yeah. And I know that this question was just to Anna, but mental health is one of the areas in which a lot of case law on health and human rights started emerging around health or around mental health. So we have traditional cases that focus more on discrimination and kind of equal treatment, but also cases, as Anna mentioned, that focus more on treatment, which is the new kind of trend of looking at health entitlements as access to treatment and services. So we have all of those, and definitely there's there's more we can do on it, but we try to have kind of a comprehensive inclusion of mental health cases.
How do you do the research sometimes for the cases that people send you cases and then you analyze later if this is a good case to publish or not, or who does the committee for filtering cases?
So the way that we work, the way that we've been populating the database is through the use of different sources. So they can include, obviously, literature, scholarship on the particular, on health and human rights related issues, or also, there are organizations that focus particularly on certain issues, where we get it from their communications. For example, there's very important listservs that track the cases that come out. At the same time, we have local partners that inform us of cases that are coming up in their countries. So it's a wide array of sources where we get the.
And the way we started this project when Anna has been working on this project from almost from the very beginning. When we started, when we brought it to the institute, we tried to exhaust all of the sources that were within our disposal: databases, articles, scholarly articles, scholarly databases, but also organizations that categorize cases, civil society organizations. So once we exhausted that, that's when we need to rely on partners to bring the information. We continue to keep track of those sources as they get updated, but this is the point in which the partners are the ones that can add more to the database, and people that know about cases that are being decided on the ground by high courts or regional bodies. Some are easier, regional, international bodies are easier to find, but sometimes at the country level, it's harder to find the decisions at the country level.
And something that I would also add is that, as I mentioned, we have an additional document section in the summary page. And if anyone in the webinar, that's participating in the webinar, is an organization that litigates within the field, we welcome, your sharing of maybe documents, that you've submitted to the court. That's something that is not available that easily, and it would add definitely to, the sharing of litigation strategies, what has worked and what has not worked.
Okay. Keith Martin is, we have a question here from Paola. She said, what about maternal health and maternal death cases?
Yes, and they are included in there. At this point, maternal health is not a health topic in the list of health topics, but they would be under the sexual and reproductive health categories, or even the health and human rights. Health and healthcare and health services as well. But that's something that we also can consider. But there's definitely cases that are in the database that regard maternal health and maternal death.
And we have the case from the CEDAW committees, Aline, the CEDAW committee, the Brazil, but also we have local cases from different jurisdictions that deal with maternal health and maternal mortality issues. So we have it.
Continue with Keith Martin. Can you speak a little bit more about where one can find good information about human rights-based approach to environmental protection?
Go ahead.
Sure. There are definitely different organizations that focus more on the public health, environment, and human rights. We have some cases that when they relate to specific health entitlements included in the database. But for example, this is not necessarily related to environmental protection, but it has an environmental component, is the water lakes database that we mentioned, that it's referenced as a resource. There are other organizations that do this type of connection. I know right now, for example, climate change is trying to do also some connection with human rights, but it's not at the core of what we do as a database. But although we have cases, if they relate to human rights and health.
Right. I guess I'll just mention just very quickly that Earth Rights International is one organization that works particularly on using human rights-based approach on environmental protection. For example, they have something, I think they've been working to an extent on Bolivia and what has been going on there.
Well, I think we don't have more comments. So thank you everyone for participating in this webinar organized by Salud Derecho in collaboration with the E-Institute. And before we finish, I would like to remind you, later at 11 o'clock, we are going to have this webinar again in Spanish for our Spanish speakers. And before we finish, I would like to thank to Anna and Oscar for being here. And before we finish, we are going to ask for a little bit of about this the technical component of the webinar. So thank you very much, and see you soon.